Welcome back to Women's Wealth, The Middle Way, the show that answers your questions about work, money, and family. My name is Susan McGlory Michael, and I am the CEO and founder of Glen, a wealth management firm in New Jersey. Today we are here again with Dr. Law, and I am thrilled because we have so much talk lately within all of our states about the taking off of our masks and the mandates of restaurants no longer in effect, in gyms fully open, traveling, and business. We're all getting back to this busy way of life. And I sincerely hope that this pandemic is over completely soon. But we are also experiencing in which many of us have lost many loved ones. In fact, 582,000 people in the U.S. and 3.3 million people globally lost the fight to this terrible disease of COVID. Today, we have to ask ourselves, how many people still suffer from the post-effects for some of those who survived COVID, but still are struggling to recover? There's an estimate of 10% of the U.S. population, which is 32.8 million, and 150 million globally are still suffering from this residual kind of symptoms. And that's why I've asked Dr. Law to join us again this month, even as the weeks and months of COVID are passing. We call them long haulers, don't we, Dr. Law?
Yes.
And among these long haulers, 72% of them are women, hence why we're having you on. Can you talk about some of the symptoms that women are experiencing that you have been seeing? And maybe we'll go into remedies and things that we can do. I'd love you to kind of update us on what are some of these symptoms.
Actually, this is a report from CDC. So reported these symptoms appear weeks after the infection and last for months, including fatigue, headache, dizziness when standing. In fact, I have patients come in and complain about that. And anxiety and depression, intermittent fever, mood swings, and shortness of breath, chest pain or pressure, cough, mostly dry cough, and difficult breathing, and tachycardia, which is fast beating heart, and pounding heart, and hair loss, joint or muscle pain, and also the brain fog continue, describing difficult thinking or concentration, memory problems. And believe it or not, that's the major sign symptoms getting the COVID is loss of smell and taste. Even months after, they still did not recover from the smell and the taste, or they gradually came back, but they taste or smell things funny, like a foul taste. And so, in other words, that just not completely recover from that. And of course, for women, menstrual disruption, which is the color change and or consistence change, or even they never had this bad PMS after that. And also, a lot of people complain about GI issues, acid reflux, and or even neurological symptoms, meaning like nerve pain and all that kind of thing.
And you're so right, because I have read so much and we've heard so much on the news, and they kind of refer them to the long haulers and what it is. But often we maybe don't think about it. We've had COVID or we've experienced it and then we forget, so we don't associate it, especially as women, because I think as women we say, oh, I'll be fine. But I think it's really important as women listening today on this podcast to hear about what the researchers are finding, and if nothing else, to be able to take that knowledge back to our health, facilities and ask the questions of, I'm experiencing this and I never had this before. So if nothing else, for our daughters or for ourselves. So maybe we want to talk about what researchers know about this long hauler after effects of COVID.
The researchers are actually still trying to understand about the virus. There's so much more we don't understand, and also the extent of damage they can cause to the human body. And as all of you to still remember watching TV with the picture of this virus, and actually with all over the place, we see this like virus look like, and you can see the spike protein outside the virus. That's what they call the S protein. So the spike protein on the virus has played a key role in the symptoms. And these S protein trigger damage to the vascular system.
Wow. Okay.
So when the S protein attached to the ACE2 receptor, it disrupts the signal to the mitochondria and cause damage and fragmentation. So that's what they're thinking. The COVID-19 virus, it's like a lurking pathogen. And then once it's in the system, it starts to move from the exterior into the collaterals and tissue and burrowed into your tissue, affecting the lungs, could be, or kidneys, could be liver, heart, even brain.
Wow. And when you think about it, many of us, including ourselves, that we've all gotten the vaccine and we kind of feel a little blessed to have it. But that being said, right, there are a lot of different ways now that even if you've had the virus and you're out there, that you can use even strategies like yourself in the Chinese medicine. How can we use some of these strategies, and what are some of the things we should be watching for, like the irregularities of menstrual cycles and things like that?
Our strategy is to really look into your body. We're going to have to clear the infection. If you notice something different than before, maybe we should actually thinking about to get some help from that. In Chinese medicine strategy, we have to go in and clear the infection in your body the first time. The second step, we actually treat each individually in a very different pattern. That's not everybody is doing the same thing. And we have doctors in our family and so many others, and they are what a gift it is to work in conjunction with Chinese medicine so that we don't always have to take medicine to cure the issue. We can actually do it in a more productive way in addition to that. But, I always put people on the spot. So here we go, Helen. What are some of the takeaways of today's podcast? Because we know that this virus is out there and people are questioning, could it come back? What happened? So what would be the key takeaways and to this COVID virus? And it's gone. We've gotten through it. But I know that one of the ones I know that we've all learned is wash your hands constantly. Wash those hands. And if we can, in certain situations, continue to wear those masks. So maybe if you could give us your top few that you think we could continue to do and things we've learned as a society that's going to make us better from having experienced this sad COVID experience. We all know that having a strong immune system definitely will help, such eating a clean diet, healthy diet, and exercise, of course, and make sure the vitamin D level actually is good. A lot of people I see coming to my office, their vitamin D level is very low. So that is key, that taking the vitamin D, go in the sun, and make sure your D is really high enough to keep your immune system strong. Okay. Now, if you suspect any possibility something weird happened to your body, could be from COVID that you got, please get help. Chinese medicine strategy is still giving the relief, the long-term symptoms, and trying to clear the inflammation and restore your organ function back to normal.
I can't thank you enough. Every time we come here, you give us a wealth of knowledge, especially for women. Too often we are worried about those around us and not ourselves. And so I think this is empowering for those that are listening today. So I want to thank you, Dr. Law, for joining us today. You are amazing. And
my pleasure.
I value all this. And I'm telling you, I'll be back with more questions because I think as women, we don't ask those questions enough. So this is going to be a nice journey that we are taking. Thanks for tuning into today's episode of Women's Wealth, The Middle Way. Make sure to subscribe to us and leave a review on iTunes, Spotify, SoundCloud, or your favorite podcast app. Join us for new episodes every other Wednesday. See you in 2 weeks.